my name is Samantha. I'm a student nurse and I'm going to be assisting your nurse today.
Great.
I'm going to close the curtain to provide patient privacy, practice my hand hygiene, and rectal dry. Can you please verify your full name and date of birth for me, please?
Rachel Valdez, October 24th, 1992.
Okay, perfect. Let me just check your wristband. Okay, great. Thank you so much. That is correct. Okay, so today we're going to be doing a full head-to-toe assessment. That will require me to touch you. Do I have your permission to do so?
Yes.
Okay, great. So I'm going to ask you just a couple universal questions. Do you know where you are, or can you tell me where you are?
Redondo Beach.
And then can you tell me today's date?
August 5th.
Perfect. And who's the president?
Joe Biden.
Perfect. Okay, so patient is alert and oriented times 4. And then have you had any suicidal thoughts or thoughts of harming yourself recently?
No.
Okay, great. Okay, so today for my equipment, I have my stethoscope, my second form of hand hygiene, this hand sanitizer, my pen light, tongue blade, toothpick, cotton ball, and my gloves. So a general survey of the patient. Her sexual development is appropriate for her age. Her skin is appropriate for her ethnicity. She doesn't show any signs of acute distress or discomfort, and there's no external devices or equipment. And then her body structure and build is equal bilaterally, no signs of any deformities or anything like that. Upon walking in today, her gait was coordinated and she had full range of motion. Her facial expressions and her physical behavior and responses have been appropriate for the situation. And her speech is clear. She does appear to be clean and freshly groomed, and her attire is appropriate for the assessment and the climate. So I'm going to go ahead and get started. I'm going to start with your head. I'm just going to put on my gloves really quick, but just looking at your head, it is normocephalic. And then I'm just going to have to get into your hair.
Okay.
Good. Okay, so I'm just going to go in and inspect your hair, just sectioning off kind of inch by inch. Sorry.
Okay.
Thank you. Okay, so I don't see any signs of any infestations or anything like that. The scalp is clean and dry. And I'm going to go ahead and palpate. Just let me know if you have any pain or tenderness.
Nope.
No, nothing?
No.
Okay, perfect. No masses or lesions or any deformities felt. I'm going to take this off in the trash can. And then just looking at your face is symmetrically aligned. Skin tone is even. No signs of any lesions or anything like that. I'm going to go ahead and palpate your temporal mandibular joint.
Okay.
Just go ahead and open for me and close. Any pain or tenderness?
Nope.
Okay, open again and move side to side. Any pain or tenderness?
Nope.
Okay, perfect. So no pain or tenderness, and patient has full range of motion. And then we go ahead and palpate your frontal sinuses. Any pain?
Nope.
Tenderness?
Nope.
Maxillary sinuses? No? Okay, great. So no pain or tenderness. And then moving on to your eyes, looking at your external ocular structures, there's no protrusions or inversions. No drooping or discharge. I'm just gonna look at your eyebrows really quick and your lashes. Sorry. Excuse me. Okay, perfect. So I don't see any infestations, and your eyeballs and iris are evenly aligned, and the color is blue. And then I'm gonna go ahead and pull down on your lower lid. Just look up for me. Perfect. So your conjunctiva is pink and moist, and sclera is white. Okay, I'm going to really quickly just test your pupils' reactivity to light. Just look straight ahead for me. I'm going to come in with the light on the side. Perfect. Thank you. Okay, so your pupils are equal, round, and reactive to light. And then just look at this for me as I come closer. Great. And then as I go side to side. And accommodation. Okay, perfect. Okay, I'm gonna now moving down to your nose. Your nose is midline on the face, and it is proportional to other facial features on your body. Can I just palpate really quick? Let me know if you have any pain or tenderness.
Nope.
Okay, perfect. And then I'm just gonna look inside your nasal cavity. Okay, I don't see any foreign objects, no bleeding, no discharge, no obstructions or anything like that, and it is a normal red color. And then looking at your lips, they are pink and moist, no pallor around the lips or anything like that. If you can open, I'm just gonna look at your teeth are white with no signs of any missing, and then I'm gonna look at your oral mucosa. Your buccal mucosa is pink and moist, and your tongue is pink and moist with no lesions. And then looking at your palate is pink and moist with no lesions, and then just at the back of your tonsils is a +1 without any exudate. Perfect. So then I'm gonna go ahead and move on to your ears. Your ears, excuse me, are evenly aligned. Perfect. And then they are proportional to your other facial features as well. And I'm gonna palpate for tenderness, okay?
Okay.
Any pain or tenderness?
No.
Okay, perfect. And then I'm gonna go ahead and look inside. If you can look this way for me. Okay, just checking your external auditory meatus. There's no signs of any redness or swelling or no discharge, and your tympanic membrane is a translucent pearly gray. Thank you. And then I'm looking at your neck. It is midline with your head. Skin is even in tone, and there's no signs of any lesions or masses or pulsations or anything like that. I'm gonna go ahead and palpate your cervical lymph nodes. So just preauricular, any pain or tenderness?
Nope.
Postauricular?
Nope.
Cervical?
Nope.
And submandibular, excuse me.
Nope.
Okay, perfect. So no pain or tenderness there. And then I'm gonna go ahead and palpate your carotid artery, excuse me. Okay, perfect. I feel it at a 2+. And then I'm gonna go ahead and listen with the bell of my stethoscope. Okay, perfect. So no bruits heard there. Okay, great. So next I'm going to have you turn around on your back if that's okay.
Yep.
Thank you. Okay, so just looking at your back, it is even in skin tone. I don't see any signs of scoliosis, kyphosis, or lordosis. And the AP diameter is less than the transverse diameter. I'm gonna go ahead and palpate. Let me know if you have any pain or tenderness.
No.
Nothing?
No.
Okay, perfect. Skin is warm to the touch. And then I'm gonna test for your chest expansion. So go ahead and breathe in and out. Perfect. So chest expansion is equal bilaterally. And then every time I touch your back, just say 99, okay?
99. 99. 99.
Okay, perfect. Vibrations were felt throughout. And I'm gonna go ahead and listen to your lung sounds.
Okay.
With the diaphragm of my stethoscope. I'm gonna start at your the apex of your left lobe. I just breathe in and out every time I move the stethoscope. And the right apex. And then right upper lobe. Left upper lobe. Still in the left upper lobe. Right middle lobe. Right lower lobe. And left lower lobe. Okay, perfect. Normal breath sounds heard throughout and no adventitious sounds were heard. Okay, you can go ahead and turn to the front, please. Okay, now just looking at your anterior chest. Skin tone is even throughout. Your respirations are steady, no accessory muscle use. I'm gonna palpate. Let me know if you have any pain or tenderness, okay? Any pain, tenderness? Nope. Okay, perfect. So no pain or tenderness. Skin is warm to the touch. I'm gonna go ahead and listen to your, actually before I listen, that's right. I'm gonna go ahead and listen to your lung sounds, okay, with the diaphragm of my stethoscope. So I'm going to listen to your right apex really quick. Your right lobe. And then your left apex. Perfect. And your left lobe, upper lobe, excuse me. Right upper lobe. Right middle lobe. Left upper lobe. left lower lobe, right lower lobe, and then right axillary, sorry, and left axillary. Perfect. Okay, so no abnormal breath sounds were heard. And then I'm gonna go ahead while we're here, check your arms. So if you can extend for me and flex, then extend again, and then rotate your wrists. Perfect. And then go ahead and squeeze my fingers. And then hold your arms up and push against me. And pull. Okay, perfect. So your full range of motion, you have full range of motion and your strength is a 5 out of 5. And then I'm going to go ahead and check your radial pulses really quick, sorry. Okay, they're at a 2+ bilaterally, and then I'm just going to check your capillary refill, which is at a less than 2 seconds, perfect. Okay, so now we're going to have you lay down at a less than 45-degree angle. So we're going to put the bed at a 45-degree angle so you can take a look at her neck really quick. If you can look that way. Just looking for that external jugular pulse. I don't see any pulsations. External jugular venous pulse, excuse me. I don't see any pulsations or distension. And then just looking at her chest again, skin tone is even. I don't see any masses or lesions. And then I'm really quickly going to just palpate your apical pulse really quick. At the 5th intercostal space mid-clavicular line, left mid-clavicular line. And I feel it at a 2+. And then I'm going to go ahead and listen to your heart sounds, starting with the diaphragm of my stethoscope. And then I'm going to start at the 2nd intercostal space on the right side of the sternum, at the aortic valve. You could just breathe normally for these. And then 2nd intercostal space on the left side for the pulmonic valve. And then going down to the 4th intercostal space, the tricuspid valve. And then, sorry, I'm going to go under the 5th intercostal space at the left mid-clavicular line for the mitral valve. Perfect. And then I'm going to switch to the bell of my stethoscope. Same places, starting at the aortic valve, and then the pulmonic valve, and then tricuspid, and the mitral valve. Okay, perfect. So S1 and S2 were heard clearly, and I didn't hear any signs of any murmurs. And then I'm going to go ahead and put the bed down completely, and we're going to take a look at your stomach. So taking a look at the contour of your stomach, it is flat. Skin tone is even in tone, and your umbilicus is midline with your head and neck. And then I don't see any lesions or pulsations or hernias, anything like that. And then I'm going to go ahead and listen for bowel sounds, just starting at your right lower quadrant and right upper quadrant, left upper quadrant, and then left lower quadrant. Okay, perfect. So all active bowel sounds were heard. I'm now gonna lightly palpate. Just let me know if you have any pain or tenderness, okay?
Nope. Nope. No. Nope.
Okay, and then I'm gonna deeply palpate. Again, let me know.
Nope.
Any pain?
Nope.
Or tenderness?
Nope.
Okay, perfect. No pain or tenderness, no rigidity, no large masses were felt or anything like that. Okay, great. So I'm going to now move on to your lower extremities. If we can put the bed up for this now, just so we can see in the screen. Okay, so lower extremities. The skin tone is evenly distributed. Hair is evenly distributed. I don't see any lesions or masses, anything like that. And then can you go ahead and lift this leg up for me? And your other leg. Perfect. And then bring your leg in towards your stomach. Perfect. And the other one. Okay, great. So patient has full range of motion, and then I'm gonna go ahead and have you push against my hands and pull. Perfect. Patient strength is a 5 out of 5. And then I'm gonna go ahead and palpate your dorsalis pedis. pulses. They're out of 2 plus bilaterally. Okay, perfect. So now I'm just gonna test your sensory really quick. So with your eyes closed, I'm gonna touch with a soft and a hard object. Just let me know where on your body it is and if it's hard or soft. Okay, go ahead and close your eyes. Okay, perfect.
Soft, right arm. Left leg, or right leg hard. Right leg soft. Left leg hard. Right leg soft. Right leg hard.
It's okay. That's okay.
Left arm soft.
Okay, perfect. Patient has full sensation of objects, and then I'm gonna put the bed up to help you sit up, and then we're gonna sit upright really quick, and then if I can have you stand, and then with your feet together and your hands at your side, we're gonna close our eyes for 20 seconds, okay?
Okay.
Go ahead. We're just testing balance. Okay, perfect. You can go ahead and have a seat. There was no swaying or anything like that, so I'm going to say a negative Romberg test. I'm going to go ahead and practice hand hygiene, and that concludes our head to toe assessment today. Do you have any questions?
No.
Okay, perfect. Well, I'll have the doctor come in, but if you have any questions, just go ahead and give us a call. There's a call light button behind you if you need anything.
Okay, thank you.
Thank you.